So, this is my reflective journal for DNPU 708 and for the entire Doctor of Nursing practice, uh, adult gerontology acute care nurse practitioner program at Bremen University. I have to say that now I have completed my dissertation writing as well as my oral defense uh, on week 4 of this course. I feel a lot less stressed out now, and I feel as though I can focus more on studying for my board exam. I must say it was or has been a very stressful process starting from back in 2012 when I first started the program, when I still remember the first immersion that we have to come up with um, a PICO question for our project for the DMP program. So at the time, I remember we were all very nervous in class, and we were not aware and have no idea what we were going to do for our projects. So everyone came up with something, and at the time, I was also very perplexed as to what I was going to do for the project. I want to do something that's gonna make a significant impact for my practice with an acute care focus, something applicable to the hospital setting. But at the same time, I do not want to do something that is so difficult and is so big that would, first of all, not gonna allow me enough time to finish within a 3 years time frame, or unable to get it done um, on times for my completion of the program. So a lot of thoughts were put into it. Um, and I believe after I wrote my PICO question, I had to revise it many times with the help of my dissertation chair and as well as the person who was teaching the class, the very first class, the theory and philosophy of nursing. Um, so after I revised and came up with the dissertation PICO question, um, I believe that at the time it was a perfect project. So, and then, but again, had no idea that it's going to be a long process before I get it completely done. So, now it was exciting because I remember having to go online and do an evidence-based researches as well as looking up on the CDC guidelines for any practices or any clinical guidelines for my particular topic, which is the use of chlorhexidine gluconate for the bathing practices of intensive care unit patients with a central line to prevent central line associated bloodstream infection. After I was able to find many evidence-based practice studies as well as guidelines from the CDC, very excited about synthesizing the evidence to see what would be most applicable to my program, my project. Um, it took a long time, but I was finally able to narrow it down to 5 key studies that I were going to use for my project. So after I'm done with that, um, I had to think about presented it to the director at my facility, as well as to think about how am I going to be able to put it in a proposal for Bremen IRB as well as for the hospital's IRB. So that was such a stressful period of time. Um, very, very stressful. I remember during the time when I had to uh, write a proposal, which was like a 40 something pages proposal, and I was just completely overwhelmed. I remember I have 5 canker in my mouth just because I was so stressed out, totally stressed out, spending 10 hours a day, more like the entire week, just to finish my proposal for my project. Luckily, Bremen IRB looked at it. Um, First of all, my dissertation chair looked at it, and a lot of editing and a lot of correction made regarding to format, grammatical errors, um, things that need to be added and things need to be removed to make it look perfect. So by the time that it was presented to the Bremen IRB, it was ready to go. So, and then Bremen IRB had approved it um, in about a month. They approved it because that was the time I remember when I turned it in. There was a little bit of a break between semesters, so it took a little while, but it's not that bad. So I was able to get it done. And for hospital IRB, luckily, the director of research said that it wasn't necessary to seek facility IRB approval. So after I got the approval from both sides, I immediately started my project at the very beginning of the month, September 1st, 2013. And my project was a 3 month period. So it was exciting. It was a new experience for me. But with the help of my dissertation chair and the my reading and knowledge that I gather and the director of the ICU at the time, I was able to put together and my project at work and able to put together a poster board and print out some decals to put on the basins and stuff like that. I was able to do walking around education for the stakeholders and mainly the nursing staff because they're the one who did the implement basically do the bathing, and that's the source of my survey personnel as well as someone who gonna implement my project. So after 3 months of vigorous um, doing up my project, I was able to get it done in December 31st, 2013, and then and after that I able to gather data from the survey and from the infectious disease control department from my facility. So I keep all that data and have them securely have them securely stored in my computer. And but at the time, I remember January of 2014. That was when that was when the main courses started, such as the advanced assessment, advanced pharmacology, and basically all the very important classes that pertain to my future practice as an acute care nurse practitioner. So after I get, so when January started, January 2014, my main focus was on clinical and studying for my ACNP essential stuff. So because of that, I was able to put my data um, on hold and focus on the clinical stuff instead. Um, from January through the end of July, actually mid-August, almost the end of August, I would say was the busiest time of my life. I was able to handle it with full-time work, clinicals, studying, reading 10 chapters in the big Harrison medical internal medicine books. So much reading. I remember that was so stressful time in my life. And so when summer comes around, it gets even more stressful and busy. And because of that, I had to take a 3 months leave of absence from work. So that would give me more time to focus on my clinical hours. And I was able to do my 500 plus clinical hours in the 3 months period when I was off from work. Um, During the time, I learned so much as in the role of an acute care nurse practitioner in a hospital setting. And so, after I completed all my clinical hours, um, I went back and I locked in all my hours and I shift my focus back onto my dissertation so that I can pay 100% of my attention to it. So I begin to analyze my data, started my dissertation writing process, and with the help of Michael Hill, the biostatistician, uh, working with him, I was able to analyze my data and put together in a chart and in preparation for my write-up. So in the month of September and October, um, such a busy time, busy with dissertation, with the preparation for my oral defense in November. Now, I was very nervous about what my oral defense is going to be. I'm afraid that I wasn't good enough, but with the help and the encouragement of my dissertation chair, Dr. Ruth Milstein, and I was able to practice, do a lot of Dr. Milstein was very helpful, and I truly appreciate um, her help and her diligent in trying to get me to be up to par prior to my oral defense, and I believe I was her first student to defense, so I of course want to make her proud and be successful in my first try, right? So did a lot of practicing with her by myself, and I still remember the day of my oral defense. It was I was prepared, and with the presence of many professors, as well as the interim dean of nursing, as well as my classmates there, as well as my partner Todd, um, I was very, I was quite confident. I feel really good about presenting my project, defending it, and after after my oral defense, I remember receiving a call from my dissertation chair, Dr. Milstein, where she congratulated me and called me Dr. Chris Tran. At that point, I just want to break out in tears of joy. All that works in the last 3 years had finally paid off in a way that it's so rewarding and it's so um, gratifying that I feel as though I put so much effort into it and so much time, and finally I can see the fruition of my hard work, dedication, time that I invested in it, uh, knowledge that I gained from it, and the ability to actually implement a doctoral level project. It makes me extremely proud of myself. So after that, I, with this pride and with this, I would say happiness, I continued to finish writing my dissertation, my 7 chapter dissertation, um, and then formatted it into Bremen University library submission format, and then sent it to my dissertation chair. So my experience with the oral defense was tremendously amazing. I feel like I learned so much from it. It was a success, my personal success. And of course, that comes with so many um, challenges that, as I mentioned throughout my recording, but every single challenge that I had to face not only helped me to grow stronger and as a person, as a student, as a future NP, as a perhaps in the future as a mentor for someone else for their project. I gained so much from it. And quite honestly, even though it's so stressful, I would not have traded it for anything else. Um, it is a process that everyone has to go through in order to be awarded the title Doctor of Nursing Practice. And I am very, right now, um, in the last 2 weeks of the program, upon reflecting back of my last 3 years, it's just so many ups and downs, a lot of happiness, a lot of stresses, a lot of deadlines to meet, a lot of writing, a lot of talking, a lot of presenting, a lot of reading, a lot of writing. It just, all of that, it just make me a better um, NP. It's gonna make me a better future NP, and I just very glad that I went through all of that. So where I'm at right now is I'm studying for my nurse practitioner boards, and I'll be taking it soon. Um, and the next chapter, big chapter of my career, hopefully will start very, very soon. Um, so again, I feel as though things happen according to plans, and I, one step at a time, um, I feel like I have done everything according to the book and according to the timelines that I set out for myself, and I'm I'm just very glad to be where I'm at right now, and I'll continue to strive for um, the better, and well, I hope I will pass my board with flying colors, and from there, start looking for a job in the role of a nurse, acute care nurse practitioner. so that I can use the knowledge that I have learned from Bremen University and to better my career. So, anyway, I feel like I have had such a great experience with my schooling, with my education, with my dissertation chair, with my classmates, with my experience, uh, studying, everything combined. I could not have asked for more. And that's it. Thank you. Okay.